Well, welcome everyone this morning to our session on acupuncture for post-tonsillectomy pain. We did get started a little bit early. Since a lot of people were here, we've started our live demo for the acupuncture, and we'll return to it at the end. And I think we'll probably have time if anyone else has maybe some back or neck pain, shoulder pain, headaches, anything like that. We might have some time at the end as well if you're interested. I'm Cho Wen. I'm going to give this introduction. I do have a disclosure to make. What we'd like to do today is we'd like to review for you the basics of acupuncture as it relates to pain management. How is acupuncture relevant in pain? We'd also plan to examine the evidence base for this integrative east-west medicine technique in post-tonsillectomy pain. And I think it was surprising to me, and I'll share with you, that there's actually been quite a number of research papers addressing this. And finally, at the end, my partner here, Dr. Ochi, will describe the rationale for and the implementation of acupuncture in pediatric post-tonsillectomy patients in his practice, which he's done now for years. So to begin, I think, is anyone here unfamiliar with acupuncture? I think most of us are pretty familiar with it now. It's gone pretty mainstream in the past few years, but it's been around again for many millennia, and it's believed to have originated in China. So in the traditional Chinese medicine tradition, the theory behind acupuncture is it relates, we are all energetic beings, and this energy in our bodies travels in certain channels in our body. And when disease occurs, what it's believed to happen is there's a disruption of the energy flow in our bodies. And acupuncture, in TCM theory at least, works by accessing these specific points along the meridians, these channels, to restore health. So if, it can go in two directions. So you can have, too little energy sometimes at a channel, or it may be hyper energetic, but what acupuncture really does, at least in TCM theory, is it balances that point, that energy. If it's deficient, it'll restore it. If it's hyper, it'll calm it down. So here's a little bronze sculpture of some acupuncture points. Do we have a pointer? No. Here, just hit that. Okay. And what I found interesting is this story about Otzi the Iceman. This was a frozen warrior or hunter that was found in the Italian Alps about 4 or 5 years ago. And what's interesting is he had all these markings on his body. And these markings or tattoos, they weren't in locations that archaeologists expected for clan markings, tattoos that we normally have today. We see people have in the back mainly, but these were along points that they really didn't expect, along the ankles, along the wrist. And so the thinking is that these were probably for a medicinal purpose. And so this may have represented a very early form, potentially, of acupuncture. And this dates from 3500 BC, so acupuncture may be even older than we thought previously. So how does acupuncture work? I don't think any of us need to know anything about TCM theory to know about how it might work. There's a neuroanatomical basis that's been studied, and here's a paper out of Nature Neuroscience maybe about 10 years ago, and it turns out that acupuncture mainly works through the activation of these adenosine local receptors that are in our skin, our dermis, our fascia, our muscles. So what they did was, in normal mice with adenosine, the acupuncture reduced their discomfort in these trials when they, these pain trials in mice by 2/3. When they knocked out this receptor in the mice, the acupuncture had no effect on their pain levels. So acupuncture may be mediated, again, we talked about adenosine. Also local factors include nitric oxide, which has been studied. And what's very interesting as well is naloxone can block the effects of acupuncture analgesia. So this is a true, physiologic effect that we're talking about. Other theories of how acupuncture may work for pain, there's this gate theory in that acupuncture may stimulate pain inhibitory fibers. There's also a two-gate control theory where acupuncture may relieve pain by stimulating certain bigger nerve fibers called the A beta fibers. And these transmit a steady stream of non-pain impulses, which again gates off places in our spinal cord to pain. So one other analog sort of to acupuncture in terms of pain control that we're very familiar with is TENS. Does anybody here use the TENS for anything? So TENS, as you know, it just stimulates the skin, but the sort of the same theory is felt to happen with TENS, is that you're getting this this gating effect. So distraction may be another mechanism by which acupuncture works. When they do fMRI studies of people who have received or are receiving acupuncture, they show activation in a great deal of different areas in the brain. So it's not just a single point. So all of these areas in the brain are involved in pain perception. Another thing I think that we're very familiar with, or some of us may be familiar with, are trigger points, or myofascial pain. These are so-called tender points. Patients with fibromyalgia have a lot of these points that are active. And what's interesting is when they studied these trigger points that have been described by mainly Dr. Travell back in the 50s or 60s, a lot of these trigger points that she had mapped out in her studies, they actually correspond almost 90 to 95% with these meridian acupuncture points that have been described for thousands of years. And I don't believe that she was aware of this, but it's just very interesting that this more recent research looking at trigger points almost one-to-one correlates with acupoints. Of course, we certainly can't discount that the analgesic effect may be purely placebo. So in terms of, again, looking at the neuroanatomical basis of acupuncture, what's interesting is we can ask our live volunteers here what it felt like when they had the acupuncture points placed. But usually what people describe is this feeling of, in TCM they call it dai chi, which is a kind of this heavy sensation, this kind of aching. And we can relate to this sort of same sensation when we've had say a bruise or something like that. So what's occurring is this, it's not this, sometimes it can be a pins and needles sensation. That's if you have a more superficial or shallow insertion. But typically, again, you're getting this distension, this aching in the deep tissues. And what we're activating, again, is probably fascia just surrounding the muscles or in the muscle tissues themselves. So in essence, what we're doing with acupuncture, the way that I think of it is, we are sensory beings. We're making constant sense of our world and processing information in our own bodies. So when you get acupuncture, what's happening is you're sending a signal to your brain. Something is going on, and so we're accessing through the peripheral nervous system, if you will, the central nervous system. So acupuncture for pain, it's been looked at in the Cochrane database of reviews. It's been shown to be effective for a range of pain conditions, including migraine, tension, headache, neck problems, arthritis, low back pain. It's been looked at for pediatric pain, and again, even in the kids, it's been shown to be helpful for headache, belly pain, fibromyalgia, juvenile arthritis. cancer pain, as well as perioperative pain. And again, many of these can sometimes be very challenging conditions to treat otherwise. In terms of safety, it's been looked at as well, the systematic review from a number of years ago. It's been shown to be very safe in a lot of studies. Typically, the adverse effects associated with acupuncture needling are local effects. So sometimes you may have some, you're going to have a little bit of a pain sensation occasionally. You're going to have maybe sometimes bleeding when the needle is withdrawn, maybe a little aching for a few days afterwards. Here's another post-op, just looking at post-operative pain, a literature review. They found a study with tonsillectomy, and acupuncture reduced pain by 36% and then 22% at 20 minutes and 2 hours, respectively. Dr. Ochi had mentioned earlier about dental procedures, and then they've looked at dental interventions, and acupuncture was found to reduce pain by 24% at 2 hours. And how is this relevant to us? This is an old slide, it's 10 years old now, but what was really interesting, and all of us of course know it, is that just 10 years ago, we, ENT physicians, were the #1 prescribers of opioids in kids in the 0 to 9 age group. Of course, we've seen a huge paradigm shift in the 10 years since. Does anyone here prescribe opioids routinely for kids? Okay, so still a few people do. So last year in the laryngoscope, they looked at pediatric post-tonsillectomy pain and nausea using complementary and integrative medicine. And what they found was honey and acupuncture had the greatest evidence for post-operative pain and nausea. All of the things that they looked at were both cost-effective as well as safe, which is of course very important to us. They did recommend against some things. Hydrogen peroxide rinses and chewing gum was not found to be effective. For post-tonsillectomy pain, this was a double-blind, randomized, controlled trial, and they found that acupuncture was effective as NSAIDs in the treatment of post-tonsillectomy pain. And they conclude that especially for patients with either allergies or drug intolerance, they would probably benefit the most. Here's another randomized, double-blind, placebo-controlled trial in a journal that we all recognize, Laryngoscope. And they concluded that intraoperative acupuncture is feasible, which Dr. Ochi will show us in a little bit, well tolerated, and it results in improved pain and earlier return of diet post-op. This was a level 1B. This is kind of our highest level of evidence that we can have. Again, here's another post-tonsillectomy pain study in the anesthesia literature, and they find that acupuncture, in addition in this case to conventional treatment, was effective for pain, was safe and well received. Specifically, there was less pain, less drug use, and higher satisfaction scores in their small trial of 60 children. And again, here's a similar study that showed acupuncture with NSAIDs for post-tonsillectomy pain in 123 patients. And what they showed was there was in comparison to acupuncture, there was an additional 3 hours of adequate pain relief past taking NSAIDs. So they used it in conjunction with NSAIDs. And then finally, I'm not going to go over this, but Dr. Ochi as well has been one of the pioneers in ENT in both doing acupuncture for post-tonsillectomy pain, but also writing about his experience in the literature. He also uses, which I believe he's going to mention as well, he had also tried Korean hand therapy, and he'll talk to you about what he's currently using. But one of the things that Jim has talked about is the overwhelming number of parents who are okay, with their kids having acupuncture. And so with that, I'm going to turn it over to Dr. Ochi.
Let's take a visit with our patients. Ma'am, do you have any comments?
So my sore throat is much better, and as you can hear, I haven't coughed.
That's great. Your check will be in the mail. How about you, Jeanette?
I can breathe very good, very good.
Same with you. Those Costco cash cards work wonders. No, I'm just kidding. So that's great. Do you want to continue, or do you want me to take those off?
What do you think? I would like that you change depending on the pain.
I'm sorry?
I would like that you change for thinking about pain, neck,
Okay.
or hernia, if you can.
Okay.
More acupuncture.
Let me get my talk first, okay? Is it when he's out now? Okay. In my practice, I ask patients, so are you cooked enough? And they say yes. Then you take them. How about you? Do you want to keep going, or you want to stay? Okay. I just taped in this one because this one sometimes falls out since it's just hanging there in the head.
It's been about 15 minutes since since Dr. Ochi did the acupuncture. Usually most treatment sessions can be between 10, 30 to 40 minutes, so it doesn't have to be like a really long time. And I know for those of you who are in the back when Dr. Ochi removed the acupuncture needle, there's pretty much all these acupuncture needles. I had a slide, but I forgot to mention. I mean, they're super small.
Yeah.
Where you're actually. There are websites.
Yeah.
But you do have to put in your physician license because it's not available at the moment.
So I'm really delighted to have the opportunity to speak with you about using acupuncture for post-tonsillectomy pain. I am Jim Ochi. I do pediatric ENT at Sharp Reed Steely Medical Group in San Diego. So my handouts, all you have to do is take your camera smartphone and point it at that QR code. That'll take you immediately to an online folder that has everything that I'm going to be talking about today, as well as my contact information if you have any questions. If that doesn't work, simply going to tinyurl.com/Jim Ochi, spelled JIMOCHI, will do the exact same thing. Whatever you do, please don't waste your time taking notes because it's all in there ad nauseum. As all of us know, as otolaryngologists, tonsillectomy, in my view, is 20 minutes of anesthesia followed by about 10 days of you-know-what at home, and longer than that for adults. And as we know, because of the severe pain that we create, young children especially are at greater risk of dehydration. And as we all know too, you can't prescribe codeine for these kids anymore. And I had been in solo practice for 22 years, and it was just me and my office manager. So basically every phone call that came into the office, I had to deal with at some level. And I always felt like there were at least 6 mothers out there in San Diego that wanted to kill me at any particular time. And I always wished and I dreamed of something I could do during the anesthetic that might blunt some of the agony that I caused these little kids. And so I'll just show you my journey in that regard. 10 years ago now, there was a study that was published from Boston Children's Hospital showing that acupuncture decreases pain and emergence agitation in children after tympanostomy tubes. This to me was such a beautifully, simply, elegantly designed study. They took a bunch of little kids getting ear tubes, half got acupuncture during the anesthetic, half did not, and then they had the PACU nurses score pain and agitation at 5, 15, and 30 minutes. The beauty of this, in my view, was that the patient, the parents, and the nurses were all blinded as to which group the child was in. And as we'll see from a couple of the graphs from that article, there was a significant decrease in both pain and agitation in the acupuncture group compared to the controls. So this is the y-axis pain score. These are the 3 time intervals, 5, 15, and 30 minutes. The white boxes are the control group. The gray boxes are the acupuncture group. And you can see at each time interval, there was a statistically significant decrease in pain after the tympanostomy tubes. Similarly, Now we have agitation score on the y-axis. And again, for each one of these time intervals, there is a statistically significant decrease in emergence agitation. This study blew me away because there were two things that I thought previously that were absolutely wrong. Number one, I always felt, and I had been told, that young children do not respond to acupuncture. That is 100% false, not only because of the evidence from this study. I can tell you personally, in my opinion, children, especially young children, respond incredibly positively to acupuncture. There's very little that you need to do to have a child receive benefit from acupuncture. Whereas older adults, which I've also taken care of occasionally, you need to make them look like a porcupine before you can get anywhere. The other thing that I thought was wrong on my part is that acupuncture needed to work only in alert and awake patients. In other words, you had to be aware of what was going on in order to get something out of it. Well, this study blew that out of the water too. And of course, as all of us ENTs know, if you can demonstrate decreased pain and decreased agitation in little kids getting ear tubes, you know and I know that if you do acupuncture or not, that kid's going to be at the bus stop the following day. The low-lying fruit are tonsillectomy patients. So I immediately ran out and got trained in medical acupuncture. I'm just going to show you, this is me putting tubes into a child's ears, and I'm just going to show you how I put the acupuncture needles in before we get going and start that, very brief surgery. So I'm just going to try to get down to the, there we are. So I'm using large intestine 4 between the thumb and index finger. That's a very good point for the head and neck pain. And I did that on both of our patients here today. And then I'm also putting another acupuncture point in the wrist next to the pisiform bone. That's heart 7, which decreases emergence agitation. I'm simply taping these needles in place because otherwise they plop out, even during a brief procedure like tubes. Running around the table, doing the exact same thing on this side. You can see that the total elapsed time is a little over a minute. And you and I know that had I not been doing acupuncture, I would have been standing around doing nothing. So in other words, this does not increase the anesthetic time for the child. A GoPro, yes. Yeah. Thank God for those. So again, I told you before that I had been in solo practice for 22 years, and during that whole time, I always felt like I was a tiny little sailboat on the vast ocean. And what I mean by that, for any of you folks, anybody here in solo practice? Oh wow, that's great. So you and I know that when you make little changes to your practice and you're in solo practice, you feel it immediately. You can tell that patients are happier. There's benefits to what you just did. More commonly, in my case, when I would do things to my practice, things would start to screw up. And guess what? I could feel that too. And so what this allowed me to do, having been in solo practice for a long time, is after I got trained in acupuncture, that it allowed me to try many different strategies over the years until I settled on a technique that made sense for me and my patients. And that's what I want to show you today. Thank God I'm not in solo practice anymore. I'm now with Sharp Reese Steely, which is a whole lot better gig, but in any event, I'm glad that there's still people out there able to make it. So this is a slide showing auricular acupuncture. And I'll explain this in a little bit. So these are gold-plated stainless steel needles that you'll see that have a shaft of 2 millimeters, and they stay intradermal, so they don't go into the cartilage. So I've been doing acupuncture intraoperatively at Rady Children's since July 2010, so that's what, 9 years. And I've never had a case of chondritis, in case you guys are paranoid about that. So there are 3 little points you'll see that I put in. Shen Men, this is what I call a chill out point. This goes a long way towards reducing agitation and anxiety in the patients. And as you and I know, for many of the tonsillectomy patients, they're suffering pain, yes, but especially for little kids, They're traumatized by the experience of coming to the hospital NPO. They have no idea. Why did mom not give us breakfast? Why am I going to this strange place early in the morning? Who are these people? Why am I breathing into this mask? And then, you do the surgery, they wake up and it's like, holy cow, where the heck are my parents? Why is my throat starting to hurt? Is this going to happen again? Like what the heck is going on? So Shen Men, in my opinion, goes a long way to chilling people out. And that goes, I think, doubly so for adults some of the time. The next point is oropharynx 1, which is located right here for obvious reasons. And then point 0, if you get into auricular acupuncture, you'll see that very many strategies include this point. This, to me, provides like the fuel to power these other points. And I have had adult patients say that to me many times, where I'll put in points into their ears, and then I will typically put in point 0 at the end, and they'll say to me things like, oh, my headache, it's starting to lift now. It sounds kind of crazy, but I'm not kidding. One of the ways that I got attracted to auricular acupuncture is during my acupuncture training 10 years ago, I learned that our military forces are using this style of acupuncture for wounded warriors to help them get off of opioids. This is 10 years ago. And for me, having never ever been in the military, I knew that, the military folks are not a bunch of laid back dudes. In other words, this has to work, and there can't be any funny business about it. And I talked to military doctors at that time, 10 years ago, stationed in Europe, and they told me that after one of these treatments, some, not all patients, admittedly, but some of them were able to get off of opioids for 3 months at a time. The other good thing about auricular acupuncture is the outer ear is accessible for almost all surgeries, whether they're ENT or otherwise. So that's one of the reasons why the military selected this style of acupuncture, is because the outer ear is one of the few areas when you're loaded up with armor, you can get to the outer ear, because there is a strategy that's heavily in use by the military that's called battlefield acupuncture. And this is being administered acutely in the battlefield setting. And again, the outer ear is a place where the medics and the nurses and the doctors can get to without having to make the patient more vulnerable if they're in a battlefield setting. So with these points in place, the patients can swim, shower, and bathe normally. In other words, I tell patients, because we're in San Diego, you could drive your child to the beach right now and throw him into the ocean on the day of surgery. It's not a big deal. These needles are stainless steel, and they're plated with 24 karat gold. The shaft is, as you can see, about little less than 2 millimeters, so it stays intradermal and does not penetrate the cartilage. And obviously this is why chondritis is not an issue. The needles come out on their own in about a week or so. And it's not a big deal if it accidentally falls into the ear canal. I mean, that's no different than a child going to the beach and having sand getting in their ear and that kind of thing. It just comes out. And if they decide to swallow it, it just means they have a gold-flecked stool in a few days. I'll show you something else that I use, which is a point finder. And I'll just explain this because this is, a little bit, in my view, it's a little Ghostbuster-ish. But basically, this is an instrument that I use to identify ear points. So all it does is it identifies areas of increased electrical conductivity. And when that happens, the little light turns green and it makes this little buzzing sound. And I use that on auricular points because for anatomic points on the body, these are anatomically defined. So in other words, we can get to them without a problem because we know our anatomy. With ears, of course, there are many, many different points packed into an outer ear, and that is obviously so very small. So I have found that I need to increase my accuracy by using this kind of device. And again, this is totally anecdotal, but for a time I decided in some of my adult patients who I was seeing at the time that I would skip using the point finder. And I actually had patients come to me and say, Dr. Ochi, when you use that buzzer thing, I find that the effects are more profound and they last longer. So I now use it all the time, even in the OR, and I believe that this has helped the patients get more benefit. So you're going to see another little video clip, and basically this is a child undergoing induction for tonsillectomy. This is the point finder. You'll see that in action. You'll see that light turns on and it buzzes. The first point I'll use is Shen Men. The second one is oropharynx 1. The third one is point 0. And you'll see I'm having a little bit of a challenge trying to identify that point. And so I've turned the sensitivity up a little bit, and then all of a sudden it works. So I put that point in, and then run around the table, do the same thing. You can see the elapsed time is 1 minute and 20 seconds. So again, it is not a big deal and does not lengthen the time of anesthesia for the patient. Yes, I do, and before intubation and all that. I'm sorry. Oh yeah, oh, this is very effective in it. Oh yeah, yeah. And then obviously now the child's ready to be intubated and we go ahead and do the tonsillectomy. I want to show you, you can do acupuncture not only during surgery but after surgery. And one of the beauties of acupuncture is you can't overdose on it. So what I did for a time in my practice when I was in solo practice is I would say to parents, well, okay, so if your child is hurting significantly after surgery and you want me to help you out, I'd be happy to try to do acupuncture on your child. Just let me know and we'll bring you in same day and get it done. So what you're about to see is a short video clip of 2 boys who are 5 years and 2 years old respectively, and both of these young men are 3 days out from their surgery. Good morning. Hello, buenos dias. How are you, Manuel? So, this is a needle, right? Right? And see, this is my hand, right? Over here, right? So I'm just gonna go like this. And it's no duele. You are so good, Manuel. Thank you so much. So it's, thank you. You are such a
Te
sweet.
lo vas a dejar ahí y te va a ayudar a quitarte el dolor, ¿ok? Te lo vas a en la otra mano también. Acuéstate, te lo vas a ir por 10 minutos y te va a ayudar para que no te duela ya.
You are so
Qué
good.
valiente eres. Acuéstate, vamos a hacer así. Nomás no te vas.
It's just right
No
here.
te vas, no te va a ligar.
So I had just done large intestine 4. This is Governor Vessel 24.5, which I had done on one of our patients, as you know. Head up just a little bit. And now I'm going to use conception vessel 23 Amazing, actually. Thank you. at the hyoid bone.
Ahí está otra agujita, no pasa nada.
See, this is my hand right
And this
here.
is the 2-year-old.
See that right there? And this is a needle, right? Now watch. See, this goes in like that. Do you see that? And see, that's not an owie. Is that okay? Okay. Okay. You're such a big boy. Oh, you are so amazing.
Good job.
I think you're the most amazing child I've ever met. I think you're a world record holder, actually. Did you know that? You are a world record holder. Your son is amazing.
Thank you.
So over the course of several months, when I was in solo practice, I gathered 31 patients who came in for postoperative acupuncture. And what I did is when they walked in the door, I basically asked them, okay, what's your pain level, or what's your child's pain level on a scale of 0 to 10? On average, it was 5.5. after I did the acupuncture, it fell to just below 2. And that was after about 10 or 15 minutes of acupuncture. The other thing that I did, which kind of really surprised me, is I asked the patient or the parent, after about 2 or 3 weeks had gone by, that I asked them, so if your child benefited from acupuncture, how long do you believe that helped your child? The mean estimated duration of benefit was 2.5 days, which I have to admit, I had no idea it was that long. If you would have asked me beforehand, I would have said, I don't know, 8 or 10 hours. But that's what the patient said. And you can see on this graph that they walk in, pain levels 5.5, now it's less than 2. Since I got trained in acupuncture, as Dr. Nguyen has shown, there's been randomized controlled trials that show that acupuncture done during surgery decreases post-op pain and improves oral intake. Just like all of what we do for our patients, acupuncture can be customized for each individual patient, so that, how often do patients show up and they'll say, well, I'm okay with you doing the tonsillectomy, Dr. Ochi, but as you may remember, when you put tubes into him last year, he barfed his brains out. Well, that tells you then that you can use acupuncture points to help decrease the chance of the same thing happening in the PACU. And obviously, I'll share that information with the anesthesiologist, and he or she will probably give them Zofran. But acupuncture points against nausea have been studied and found to be just as effective as Zofran. The other thing is, not only is it effective, it is safe. Acupuncture, as Dr. Nguyen went over, is as safe as prescribing penicillin, and that's true in children as well. So is it possible to put someone in the hospital after prescribing, penicillin? Yes. Is it likely? No. The last thing, which I'll just touch on, is for a year, I tallied up my count of patients, or parents really, who opted to have acupuncture for their child during surgery. And almost 400 patients came in the door to get some sort of anesthetic procedure under general anesthesia at Rady Children's Hospital. 388 of them opted to have acupuncture, for a total percentage of 98%. So in other words, my point in publishing that article was to tell doctors, because this is often asked of me, well, Dr. Oji, if I go get trained, how often are people going to want to have this done? I can tell you, it's basically everybody, and I just wanted to document that, for other folks. Another thing you should know is acupuncture coexists very peacefully with Western medicine. So what we can see here, of course, this is the O2 sensor. This is the IV. We can see large intestine 4 in place. We can see heart 7 right here at the wrist. You can also see master of the heart 6 here. This is the anti-nausea point, or one of the anti-nausea points I use in my practice. These, coexist very peacefully with what we need to do for our patients. I've never ever been denied, having to give a person an acupuncture point because of these things, because you can always get around them. It's not a big deal. For those of you that are thinking about possibly getting trained in acupuncture, my suggestion to you would be to enroll in a course endorsed by the American Board of Medical Acupuncture. There are plenty of them out there. I personally got trained through an outfit called the Helms Medical Institute. Dr. Helms has trained more physicians in medical acupuncture in this country over the last several decades than any other human being. And so it's a very well-established, very well-recognized course. It gives you 300 CME credits. The way it works is it's a 6-month part-time course, and they ask you to show up for 3 clinical sessions of 5 days each. So it's 3 5-day clinical sessions, and in between those clinical sessions over the course of 6 months, you study and you take tests and that kind of thing. But that will eventually lead to board certification if that's what you choose to do. Most states in this country, thankfully, allow us doctors to practice acupuncture under the authority of our medical license. So in other words, in the state of California, I can hand you guys a box of needles if you were also licensed in California, and you could immediately start doing acupuncture under the authority of your license. Now, obviously, no reasonable doctor is going to do that because, you know, you need to know how to do this, and you need to know where the points are, and you need to know what the potential complications are, and so on. But I guess my point is, in any state in our country except, I believe, Hawaii, Montana, and New Mexico, you can just go get a box of needles and get going. So there's very little in the way of legal or bureaucratic hurdles for us. The last thing I want to touch on, and this is something that I've realized over the years, is that money is probably the last taboo in our country. So for doctors that are interested in acupuncture, sometimes they'll come up to me and they'll say things like, well, what has this done for your practice and that kind of thing? Well, really what they're saying is, how much money are you making off of this? I want you to know that acupuncture will not make you rich. In other words, if you're thinking about doing this because you want to make more money, my advice to you is don't bother, because this is going to be very frustrating for you. But what I've realized over the 10 years that I've done acupuncture is that, you know, medicine, as we all know, has become, unfortunately, very cold and impersonal. In other words, we feel separated from our patients because of all the bureaucratic baloney we have to put up with, electronic records, and all the other stuff that you and I know so well. And what I didn't realize before I got into acupuncture, but I realize now, is that my patients and I feel closer than I have ever been. In other words, when you do something to help a patient using acupuncture, they know and you know that it is your training, your expertise, your hands that made them better. And they appreciate that, and they value that. Not some bottle of pills that they got at the pharmacy the next day that cost them a bucket load of money and gave them a load of adverse side effects. It has really warmed up my practice and made me feel much more valued as a doctor than I have ever before. Thank you very much. I'm happy, and I think Dr. Nguyen would be very happy to answer questions and maybe needle up some more people if you feel like it. Yes, sir.
Is it paid? Will it pay for supplies?
If you charge for acupuncture?
Yeah.
Well, the needles are 10 cents each, so, you know, it's just not a big deal. I mean, at Sharpie Steely, thankfully, our policy is we don't charge for medical acupuncture because most health plans will not cover that. So it just becomes a problem because, you know, the patient, you know, gets their surgery covered, and then if you charge them, say, $100 or whatever for the acupuncture, that causes some problems. So at least within the medical group that I'm with, they just decided at the outset they want to keep people happy. We're just not going to, you know, code for it. And that's been absolutely fine. My personal advice is I think that's the right thing to do. That's just me. Medicare does not yet cover acupuncture for surgery. It is about to cover it for back pain. Yes, sir.
Questions. Does it work in adults? The other question is, when do you use the gold-plated needles as opposed to the red needles?
That's a great question. Number one, yes, it does work in adults. Really, acupuncture, there are almost an infinite variety of different schools of acupuncture. The reason that I've chosen the ones that I have is because of the effect that you're trying to bring about and the duration. So that, for example, you could use auricular acupuncture even for ear tube patients. But again, you and I know that if you do nothing, those kids are going to be fine. And so it's sort of a targeted, focused approach that I use for the ear tube patients that will get them over the hump of coming into the hospital, getting the thing done, because they're going to be fine by the time they leave. The tonsillectomy patients, as you and I know, they're going to look okay in the PACU, but after all the fentanyl and everything is evaporated in a day and a half, then they're going to be unmasked, and that's when the real recovery begins. And see, if they still have the acupuncture points in place in the ears and they last about a week, that's going to cover most, if not all, of their 10-day recovery. So it really comes down to your preference and what you think is in store for the patient. And see, the other thing I just wanted to mention is some doctors have said to me, well, I'm just going to have my anesthesiologist do this. my personal advice is I don't think that's a good idea, because the only person that has seen that patient before they come into the OR is you and I. In other words, we're the ones that know where the surgery needs to take place. We know what we're about to do. We know what the postoperative course is likely to be. And the anesthesiologist, of course, when they're putting the patient under, they're managing their airway, they're putting in the IV, they're intubating. In other words, they got stuff to do. We're the ones that are standing around twiddling our thumbs. And that's when we can implement the acupuncture for the benefit of our patients. Yes, ma'am.
The question was, how do you decide whether you use ear acupuncture or full body acupuncture for the tonsillectomy patient?
Well, I had at one point tried just using body acupuncture, but my feeling when I was in solo practice is that it didn't seem to have enough of an effect, and it did not seem to last as long as I would have hoped. And in my little retrospective study of postoperative acupuncture, the average duration of benefit was 2.5 days. So you and I know that tonsillectomy is going to cause pain for a whole lot more than 2.5 days. So you want to give them more of an effect. And I should also mention that I have found in my career that, for example, if all of us have migraine patients, the auricular acupuncture works beautifully for migraine patients. And what I have found over the years is that at first the migraine patients need to come in about every week to 10 days, but very rapidly it stretches to months. And it works especially well for vestibular migraine patients. And so I guess my point is that the auricular acupuncture seems to last longer, it has more of an effect, and if you need to repeat it in some patients, say non-surgical patients that have migraine or vestibular migraine issues, I just want you to know they're not likely to clog up your clinic, because again, they're going to start coming on the order of months between visits, and sometimes I've had people disappear for years. And I'll tell you again, the migraine patients, I think, are probably the most grateful people in my practice, because as you and I know, most adult migraine patient sufferers have had that for decades. And the beauty of it is when you do something for them, they can say very precisely, my nausea is 20% better. My pain is 30%. In other words, they're very precise, and they know their symptoms very precisely. Yes, sir. That's a great question, because as far as I know, well, there's no one I know that was doing intraoperative acupuncture. So when I first started doing this, I was totally paranoid about burns. But first of all, I can tell you that I have never had that. And of course, doing bovine tonsillectomy, that's a significant issue. But what I have found is that even if I were to do body acupuncture on the tonsillectomy patients, all you need to think about is it's a good idea to buy plastic-handled stainless steel needles, which are the red things that I showed you, because obviously the plastic's not likely to be conductive. And by taping them in place, that's another barrier. But again, I have not ever had a bovine burn.
How about the ear?
That has never ever been an issue either. And I don't, I put them in at the outset, so I'm not covering them. They're just out there.
What is the cost of the auricular points that you're putting in? Is that different than the body?
They are. Those are, I believe, the most expensive acupuncture points available for use in this country, and they're 50 cents each. So when I went to the hospital and I said, would you please buy these for me? They said, well, how much do these cost? Because, they're used to getting hit with significant amounts. And I said, well, they're 50 cents each, but I think if you buy them in boxes of 200, it goes to 48 cents each. They said, Jim, I think we're okay. So I don't think a hospital should have any problem covering that.
How much is that pointer?
This thing? It could have been 60 or 70 bucks. It was, I can't remember. I bought it 10 years ago. Yeah. Yes, ma'am.
Do you use acupuncture in kids outside of the operating room, or do you use it for?
Well, I have previously. The long story short is at Sharp Steely, I have a significant backlog, so the medical director has basically asked me to curtail my activities and try to keep it to postoperative pain control. But the answer to your question is yes, when I was in solo practice, I did a lot of that. And obviously, it's often questionable as to whether or not a child is going to go along with it. But that's why I take a needle and I shove it in my hand to the hilt, because that has made a big difference in how patients perceive things. And because if I were to say to a child, no, seriously, this doesn't hurt, they're going to be out the door. But if I hit myself with an acupuncture needle and I put it in all the way, even little kids will look at that and think, well, you're kind of weird, but you're not a liar, And so more often than not, they'll go for it. And if they are really suffering, I have found that children, will likely go along with it because, they want relief like any other normal human being. Yes, sir?
Of course, it's best to get board certified and finish a whole training course, but do you think it's a bad idea to learn a few tricks and start implementing it without having formal training?
I don't think it's a bad idea. One scenario I can envision is, let's say that you're in private practice and you do surgery at an outpatient surgery center. I had done that, I was in solo practice and I was in that same situation. I remember I went to the outpatient surgery center and I said, you guys think I can do this? And they basically said, yeah, sure. I didn't have to show them anything, so in that kind of situation, probably be okay. It just turned out that when I went to Rady Children's Hospital and I started asking around, then, they basically wanted to know that I actually had gotten trained, and the way that many medical staff offices are, they want to see that you are either board certified or working towards that goal. So to keep them quiet, I basically did that. It's not a big deal. You take a test and, that kind of thing. And you do have to study and pay attention, but all of us went to med school, and I can tell you, I know that all you guys can do it,
Can we use this for nasal surgery?
Yes. What I have found in my practice of pediatric ENT is that for septoplasties, this is great because I believe that the patients are doing better postoperatively, but also, when you bring the patients back in a week to get the septal splints out, I used to dread that appointment because, it was a lot of crying and screaming and that kind of thing. But what I realized is that if you do acupuncture on those patients when they come for their splint removal, what it does is it decreases their anxiety, but it also opens up their nose. In other words, a lot of their discomfort has to do with the mucosal edema, making it so that it's holding the splint, tightly in place. And when you remove it, obviously it hurts like heck. So if you use acupuncture to open up the nose, like I did for this doctor here, what you're doing is essentially decreasing the mucosal edema. And very often, the splints will just plop out. And I've had children say to me, when are you going to do it? And I'm like, we're done. And it has made it so the post-op splint removal I look forward to now because, I know likely this child is going to be nothing but happy.
Do you use that ear acupuncture?
No, I don't for that. I use LI4, large intestine 4. I use governor vessel 24.5. And basically what I'll do is I'll let them kind of, cook like that for about 5 or 7 minutes. I'll come back into the room and ask the patient, so does your nose feel different? And a lot of times the kids will say, oh yeah, now I can breathe around the splint. Or they'll say, I feel boogers just sliding down my throat, because obviously the mucosal edema has allowed that. If they say, no, I haven't noticed much difference, then I'll often do large intestine 20, which is right here, because that tends to really open the nose up. The only disadvantage to large intestine 20 is that in some patients, it's a little bit of an owie. So if it's an older patient and I think that they can tolerate it, I'll use those points as well. And that almost always makes it so you can slide the splints out, no problem.
Have you ever tried it for postoperative pain for the septoplasty in the first 3 days?
Interestingly enough, at least, so far, I have not had much in the way of post-op pain calls from septoplasty. And especially after having done the acupuncture, I've had plenty of kids show up and I'll say, I hope you didn't hurt too much in the last week. And they'll say, no, I mean, was a little bit of pain, but not a big deal. It's just I don't like the fact that I can't breathe through my nose. And that to me was stunning because, it used to be that kids would complain about pain,
You get them auricular acupuncture for the nose?
No, I do here, governor vessel 24.5, large intestine 20. Oh, yeah. And I tape those in place just because if you don't, then it kind of makes it so that, the needles might fall out and that kind of thing. Yes, sir.
There was a recent article from one of the military branches about acupuncture post-tonsillectomy in young adults, and they didn't find very good results. Are you familiar with that?
I did read that. The thing that I, at least to me, if that's the same article, what they did is they took a bunch of folks and they trained them in battlefield acupuncture, I believe it was. And see, to me, when you take non-physicians and you do that, I believe you're at risk for, situations where I wonder how adept they were at hitting the points. Because, for you and I mean, if you're going to go through a course and go through all this stuff, you're going to be very particular. I know for me, I wouldn't feel comfortable just saying to someone, okay, you go ahead and do that, and then let them, do that without me being directly in attendance. Because especially with the ear acupuncture, if you're off by just a few millimeters or even less than that, that can change the outcome significantly. And when I looked at that article, I thought, well, you guys kind of set this up so that there was a big opportunity for it to not work. That's just my opinion. Yes, sir.
Is there a laterality? So if you do a surgery on the right side, you only do the right ear?
That's a great question. In acupuncture, no, there isn't. So, in my view, there's no reason not to do both sides. Yes, sir.
Does it work for trigeminal pain or acute sinusitis pain?
Yes, I've done it for both of those, and really, I have found that to be very, very rewarding. In general, it's almost like the more acute the pain, the better the chances of making this patient happy. So that when I was treating migraine sufferers, adult migraine sufferers, this is going to sound maybe kind of evil, but the worse the patient was, I'd be like, oh, good. I think someone's going to like me today, because the worse off they were, sort of like the happier you can make them. Yes, Dr. Wolf.
Have you tried this on anybody with Eagle syndrome or glossopharyngeal neuralgia?
That's a great question. I believe I'm about to see my first. I told you that I was supposed to keep this to post-op pain, but you know how there's a little arm twisting within departments. So one of my colleagues has identified a patient that has had refractory glossopharyngeal or Eagle syndrome or something like that, and been around to just about everybody else in the department, and they want to shovel the patient over to me. And I said, well, okay. I mean, with that kind of peer pressure, I don't know how you can say no. But I'm looking forward to seeing that patient because, see, what I've realized in getting trained in acupuncture is it makes me realize how many patients that we see fall between the cracks. In other words, patients who suffer mightily, they go to the doctors regularly. They go to every doctor they've been asked to see. They get all these procedures done. They get all these surgeries done, and they still suffer. And then, and only then, people will say, well, I don't know, why don't you go get acupuncture? Well, what I've realized is that acupuncture is likely to probably be helpful in that situation because, nothing else has worked. I mean, at least in my opinion, very often that it doesn't make it cured, definitely, probably, because whatever is happening is very deep-seated and there is no known cure for that. But some of my most grateful patients have been in that situation. And again, it has just made me realize that that's a much larger portion of, I think, any person's practice than you realize.
So for instance, I'm just thinking application. So if I have it seems to be my teenagers and my kind of college age post-tonsillectomy patients who seem to be really miserable.
Yes, mine too.
I try to convince the ones that are 30 and 40 that maybe they don't want to have their tonsils out. But would it be a scenario where you would do the auricular acupuncture, and if they're coming back post-op day 5, post-op day 7, where their implants have extruded and they're still having pain, that you would repeat that in the office, or would you body acupuncture at that point, or?
You know, that's a great question because I have been in that situation before. Usually what I'll do is I'll try body acupuncture because in that instance, the patient would be about day 6 or so, right? So you just need to push them through to the rest of it. And, you know, sometimes I have found that if someone has had auricular acupuncture and the needles have come out, in the world of acupuncture, just because the needles have plopped out does not mean the patient isn't possible or likely to be reaping benefits from it, even though it may have been less. And because those things have been in there for a number of days before they plopped out, those areas are still sensitive. So in other words, for me to take a new needle and put it through, that's going to be maybe more of an owie than I want to give the patient. So what I'll do is I'll try body acupuncture first because it's simply a different strategy. And so it's more likely, you know, I think to possibly have an effect. If the patient says to me something like, you know, doc, when those gold things were in place, I was really, you know, a happy camper, then obviously I'll try the auricular acupuncture, but I'll do it usually after the body acupuncture. In other words, to get the benefit of both. Does that make sense? Because there's no reason not to. You know. Yes, sir.
Similar cohort patients or teenagers, have you found that you increased your narcotic prescription for that subset of patients by doing acupuncture?
Have I found that, I'm sorry.
That you've decreased your rate of narcotic prescription for the teenagers and college students?
Well, in the state of California, we're not allowed to write more than 5 days at a time. So, actually, that's interesting too, because in general, if someone really wants a refill, I'll basically say to them, you need to come in and see me. Because again, in the state of California, that means you have to go to this website and, you know, log in and all this baloney. And, you know, I just don't want to be in a situation where someone's going to say, wait a minute, you know, I mean, I want to bring him in and offer him acupuncture and see if we can get over it that way. That's just how I've done it, you know. But I would also say that really the number of patients that have asked for a refill or that kind of thing, or the number of phone calls that I've gotten for post-op pain after tonsillectomy, this is just my subjective impression. It has greatly decreased. It is nowhere near what it was before. And it's almost kind of not really an issue, you know.
I guess that answers my question.
Yeah, I'm sorry, I can't be more definitive than that, but I guess I just haven't really thought much about it, I guess, you know, about the issue of refills. I'm not sure that I've written a refill or a secondary prescription that I can remember, you know. Yes, sir.
In your vast experience doing this, obviously you talked about many times that you use it. Are there times that you know that are definitely not used? You mentioned it earlier in the lecture that certain medicines, actually I guess the
Naloxone.
Yeah. Are there certain ones that you know, hey, this patient's on this medicine, this
I have not found that. And actually, you know, because I am almost exclusively pediatric ENT, so you know, when I started working for the medical group, and I saw adults like on call and that kind of thing, I wasn't totally aware of how often people are anticoagulated. You know what I mean? And that's never been a problem. It's sort of like after the treatment, it's like, holy cow, he's on Coumadin, you know? But no problems, you know? So I have not found there to be a contraindication. I believe, though, that if a patient is really allergic to, I think it's nickel, then that would catch my attention, because I think there's a bit of nickel in the acupuncture needles. But, you know, the gold-plated ones have stainless steel. They're stainless steel plated with 24-karat gold. So in other words, there's no stainless steel in contact with the patient.
Where can you purchase the equipment? Where can you purchase?
I think that Well, if I'm not mistaken, the gold ASP needles can only be purchased through LHSA OMS, and the website is LHASAOMS.com. You know, and I think they're the exclusive distributor for that type of thing.
What about the pointer?
If I'm not mistaken, I think Sarin also is only distributed in this country through that.
Sarin,
Yeah, to me at least, they're like the most deluxe brand of acupuncture needles. In other words, they are extremely consistent. They slide in very smoothly. They don't stick. I've tried other cheaper acupuncture needles on myself, and there's no reason not to get these because they're 10 cents each.
And the pointer indicator, that's the same place, you buy it from the same place?
Yeah, actually, they sell a bunch of those. In my view, they have a bunch of newer ones that, you know, that look more stylish. They almost look like little spaceships and that kind of thing. In my view, you only need the most basic one. Like, I have never yearned for a newer model, and this is 10 years old. Thank you
Thanks,
so
everybody.
much for coming. I really appreciate it.